All right, welcome to the next installment of Live Well with UCI Health. My name is Ryan Mano with iHeartMedia, KOST 103.5. We are here at UC Irvine's new state-of-the-art hospital in Southern California, reimagining the way a hospital interacts with its community. I am sitting with an esteemed panel of three of the folks making this place happen, and wow, are you making it happen. Let's go down the line. Introduce yourselves.
Hi, my name is Jess Langerud. I'm the principal project manager for the construction of this facility.
Josephine Reyes, I'm the VP of Nursing and also one of the activation team leaders.
My name is Joe Brothman. I'm the Director of General Services here at UCI Health.
All right. So let's start with you, Joe. What will patients and visitors notice and like about this facility other than everything?
Great question, Ryan. I would say immediately the access of the hospital and its campus off of Jamboree. You will see sort of the immersion of the nature that surrounds this actual building, which I think is really a plus for the patients in our community.
Yeah.
Yeah, I think as you turn into the campus right off of Jamboree, the whole campus kind of reveals itself to you between both the hospital and the two ambulatory centers that are already open. Mm-hmm. And then the whole campus is organized around the wetland in trying to give access to it, sight lines to it, both for our patients, their families, and our coworkers.
Yeah, that's awesome. I don't think I've ever pulled onto a hospital campus and audibly in my car said, whoa. I mean, it's stunning when you first pull in here. It's pretty remarkable what you guys are doing. Jess, UCI Health Irvine is being called a high-tech hospital of the future. What are some of these high-tech innovations and things that you guys have going on?
Yeah, so in the planning and the concept of the hospital, we really work to bring all of the cutting-edge technologies in to leverage, and so that the building itself not only houses the care that happens within it, but really works to facilitate it. Whether it's from patient monitoring, the imaging services we provide, the laboratory, pharmaceuticals, everything top to bottom is really meant to facilitate the care, bridge the gap between the coworkers and the caregivers and the patients that they're taking care of, and to kind of create that cool, calm, soothing environment to make people feel happy and healthy.
Yeah, that's awesome. Let's go down to the end. Joe, it is the nation's first all-electric acute care hospital. What does that mean?
It's a great question. So this entire campus, all three buildings, utilize no carbon combustion for electricity. So we have two giant solar arrays on top of our parking structures, but also all the electricity that's utilized on all the buildings is green electricity. No natural gas is utilized in the kitchen, in our steam power generation, or any other heating, hot water, or any other fuel source here in the medical center. Yeah. So all of the electricity, heating, or anything utilized, the lights or anything here utilizes carbon fuels for our energy sources.
Yeah. Have you already had other hospitals saying, how'd you do that?
Many other hospitals.
I bet. Yeah, that's incredible. All right, Jess, there's a floor on the garden level being called a surgical mega floor.
Yes.
Do I have that right?
Yeah.
Talk to us about that. What is that?
So what we did between our ambulatory cancer center, the ACC, is categorized as a hospital support building, primarily targeted for outpatient care, but we married it up to the inpatient hospital and merge those surgical floors. And so we're going to have 10 general ORs already operating on the outpatient side with 4 procedure rooms that are now going to match up with an additional 7 general ORs, 4 hybrid cath lab ORs, and another procedure room to create a giant mega floor where our patients can have the best care. We can get operationally the best flow. It's convenient for surgeons that can bounce between an inpatient surgery and an outpatient surgery. We can have patients arrive on the outpatient side, have their surgery, and then be admitted into the inpatient hospital as needed. And we can flex between those. And on the first floor, you really won't notice a boundary between the two buildings. You will just flow from one area to the other with very few obstructions.
It's kind of like if you're getting a house, you're like, knock that wall down. I like the open, right?
Yeah.
That openness to it.
Yeah.
And I don't know much about how other hospitals are structured and arranged. did it used to be that you'd have to go from floor to floor, this place to this, like kind of bounce around?
Right. You would have, an outpatient center over in this
Sure,
corner,
okay.
an inpatient center over there. For us, it's all combined all together. It's over 3 football fields long from end to end, with a clean core in between where all the materials and supplies and the OR techs can have direct access to what they need, pull it into the various ORs to prepare for the procedures. As well as our pre-op and post-op has its adjacencies right there. The interesting thing that happens when you take that entire first floor and create that space is now it's displaced other services that would traditionally be in the basement.
Okay.
So my kitchen is on the 3rd floor, as is my laboratory, my pharmacy, my biomedical engineering, respiratory therapy, and my technology team have all moved from the lowest level of the hospital to the 3rd floor, and they all have great access to windows. They can see the wetland,
Yes.
and they have an even better experience coming to work.
I love that. Now, Josephine, he mentioned the wetland. There's a big emphasis put on nature, and you see it and you feel it when you're walking through. You're like, it's very different. Talk about the importance of that and having it here, and really the importance of nature on healing.
Yeah, absolutely. There's a lot of research that actually points to your environment. And so I think a wonderful piece in this planning and design is really the concept of a healing environment. And that's what you see here, starting with a few sort of design concepts. The windows are large.
Yeah.
There's a lot of natural
light, yes.
which is wonderful for reducing anxiety, for patients' healing and recovery. They're all patient private rooms, which is extremely important for patients. They understand the need for privacy and comfortability. There's large furniture for patients' families, which is another part of the design, because we want to be very inclusive to allow for that family to be able to come in and be part of the plan of care and help the healing process for their loved ones. And I think overarching, we are creating an environment within the departments to really help reduce noise.
Yeah.
And so a lot of our also technology that we use reduces alarm noise, which is very difficult for patients for sleep. And as we know, sleep is very important for the health of our patients.
Yeah.
And so the nature and the ability for them to see outside the window
Yes.
is probably, in my mind, the most important piece, because a lot of these patients sometimes are just not too well to be able to go outside. So the ability for them to see the sun, the marsh, the nature is really healing overall.
And what a difference that will make. Now, you mentioned the patients looking out the windows, but what about inside their rooms? What are the patients going to notice and really kind of love about being here?
You want to talk about the smart TV, Jess?
Yeah, so I think the first thing that everybody will notice is the 75-inch television that's on the footwall. You just can't get around it.
Do you remember really quick, like old? The last time I was in a hospital, it was like that little tiny
The 14
box.
Little
inch
box in the
14
corner.
inch, yeah.
Yeah.
on an arm.
Yes.
But it's not just there for entertainment.
Yeah.
It really has a clinical purpose in it, because one of the big items that's missing is that whiteboard that everybody sees in every hospital room, that maybe it wasn't updated or it looks dirty because it wasn't washed well or this or that. We don't have that. Our digital whiteboard is integrated into that picture within a picture. And it's pulling everything directly from the electronic medical record. So it's as current as 10 milliseconds ago.
Whoa.
So the patient knows who their doctor is, who their care team is, what significant goals they have for that day, what else is happening, procedures, everything else like that. And then what happens behind that system is that the care team can prescribe, if you will, patient education videos to the patient that are related to their patient care. They watch their video. At the end, the system knows that you watched your video, so then it transmits that back to the electronic record, so we have documentation of some of the patient education that you got. And then the last piece that everybody will kind of really enjoy is you're going to order your food through the television.
Come on, stop it. Where are we?
So,
Yes.
So it's going to know all of the menu options that chef has prepared for that day. It's going to look inside the electronic medical record and see what dietary restrictions your provider has prescribed to you, match those two together, and then present to you your menu options that you can choose for breakfast, lunch, and dinner.
Have you thought about turning some of the rooms into rentals? Because I'm interested.
You want to put a reservation
weekend,
in
you know
now?
what I mean?
Yes.
Just a long weekend.
Yeah.
Maybe a 3-day.
Yeah.
All right, let's talk about the food. Where are we at on everything else here is great. I imagine that there's been some upgrades and some improvements on food, Joe.
Yeah, the all-electric kitchen here in our hospital has a great menu. The kitchen in the hospital features all-electric appliances. The chef has created a menu that has food that is world-class. We have beef pho. There's green smoothies. Everything in the kitchen has all-electric appliances. There's no combustion, just like the rest of the features of this hospital. If you go through the kitchen, it's clean, it's beautiful. There's still going to be grill marks on your steak when you order it because we have an infrared grill that's featured in there. But there is a full-service kitchen. The cafeteria is going to feature a full-service tray line, so the staff and the guests are going to have every selection just like any other hospital, actually just like any other restaurant.
Yeah.
I think this is going to be an elevated experience compared to a lot of other hospitals in the area or frankly anywhere else.
Yeah.
So we're really excited to feature what this place is going to offer.
That is so cool. Jess, let's talk about the artwork. I know there was a lot of thought put into choosing the art for the hospital. Can you walk us through what that was?
Yeah, so we have an art committee that really just kind of works to match the artwork to the environment and really take it up to another level, that overall sense and feel. So the work they primarily focus on California Impressionists. They have some connection to the local area, whether the subject is about a local area, a local beach. They even have kind of a Da Vinci Code about the artwork that's similar in one area to the next. I haven't cracked the entire code myself, but they tell me that it's there. So I accept the challenge, but I've yet to pass it. And then we're also going to have a gallery wall for the main hospital corridor that goes from the main entrance to the cafeteria, where we're actually going to have rotating pieces that are going to come from the University of Irvine's art collection that will come through for a period of time and then rotate through. So not just permanent pieces, but then pieces on rotation.
Yeah. What about overall, how will this new facility improve access to care for the community?
I think just its locality, in sort of by the design of it being off the campus. I think part of the planning and the concept was really coming back to UCI Irvine, right? And from a university perspective, especially its strong connection to the School of Medicine, the School of Nursing. I think that's an important component, and really understanding what that means as we look into the future, especially with research and patient care. I think the other component that's important is there's a lot of ability for our Orange County in the south area to have access to this facility versus having to drive additional miles to a further, location. We have this particular campus and its adjoining campuses for our ambulatory and outpatient services that will allow for ease of services that people would need. I think that's an important perspective because patients are really looking for their convenience to be able to make it easier for them to access care, and we have to be able to do that.
Yeah.
Yeah, the university had always planned on having a medical center as a part of its campus. And so this is really more of a homecoming in that way. Since 1965, there had always been the concept of having a hospital on campus associated with the medical school and the other health sciences school. And the other thing in us coming back to here is we're now bringing academic medicine to an area of the county that didn't really have it before unless you traveled all the way to our Orange campus. There might be other hospital providers, but we really are the only cutting-edge academic research medicine provider in Orange County. And so we're bringing that level of care to the community here in South Orange County.
Yeah. Joe, from your point of view, your understanding, what differentiates this about, from other hospitals in the region?
The all-electric medical center here has no negative externalities from our operations. So what's really unique with the cutting-edge aspect of this hospital, we are going to be operating with no carbon emissions that are going to negatively impact our community partners here. If you look out here, our amazing wetlands that we have, our amazing neighbors that are UCI campus partners, for 100 plus years, we're going to be operating this campus with no negative emissions.
That's incredible. It really is incredible.
And the thought that went into this, our ambitious leaders who decided to undertake this project really had some great aspirations when undertaking this project. And a hospital of this size, it takes a real village to go about making this place happen.
Yeah.
The other thing I think, like Jess was saying, our UCI Health campus in Orange and our community networks, we've never been busier. With the growth of this site, we're going to create 140 plus new beds for Orange County to now have more access to academic medicine. We're the only academic medical center in the county, and creating this new hospital provides more access to the county. And not only that, it's the first of its type in the world that we can create that for Orange County residents to offer. So we're really excited to offer that for everybody.
Yeah. In terms of patients and the community, with the design of this hospital, Josephine, how were they considered when you guys started doing what you're doing?
Well, I think historically what I've heard is a lot of it had to do with their ability to understand what the patient needs, right, Jess? And I think having, not been here during that time, I think I'll offer Jess some, sort of insights to that. But I would say that the patient's voice is always at the center of the way we make decisions at UCI Health, and I think that's an important perspective.
Yeah, and it went through evolutions in design. The initial concept was a much smaller 77-bed hospital without an emergency department. And then it kind of, as they did analysis, it grew and evolved to 110 beds with a 10-bed emergency department. And now here we are at 144 beds with a 20-bed emergency department, a 16-bed outpatient observation area, a very robust imaging capability with 2 MRIs, 2 CT scanners, 2 ultrasound rooms, fluoroscopy, plain film imaging, and all of the multitude of services that we're able to provide. And so it grew as they did that analysis and they looked at what the needs were in the community and then forecasted what would be a fantastic starting spot that would enable us to grow into the future to continue to provide services.
Yeah.
Another interesting part to that, this hospital was programmed during the pandemic. All of the rooms in this hospital can flex up to ICU level of care. So even the med surge and observation level of care beds, if something happens, we can put ICU level of care patients into all of the rooms here. So the care that we provide today might change into the future, and we can flex all of the beds here as the care needs of the community change.
Which is not a normal design in a lot of hospitals.
I was going to ask.
That does not exist.
I was going to say, especially in like a post-pandemic world, you
It's
you
very
guys
thoughtful
probably
in the
really had to
design.
make some new choices.
We're making
Okay.
history here at UCI
Yeah, heck
Health,
yeah.
that's all I'm going to say.
Come on down. Don't purposely have to come here, but if you do, 5 stars. Give them a good Yelp review. What does this hospital mean for the future of healthcare in Orange County? And I want all 3 of you to take a stab at that. What does this place mean for the future of healthcare in Orange County?
I think access is a huge satisfier for a lot of people, right? Because even for us at UCI Health, we're members and we're patients as well. And I think what's very key for this particular hospital is the community that it serves. And I think what I enjoy so much is every day in this last year that I've been on the campus outside of the hospital, a lot of the members who walk by ask, when is the hospital opening?
Yeah.
And are very excited.
Yes.
And I think what is important about that is the energy and the sort of inspiration that inquiry brings, and that we're excited to provide these services for our patients.
Yeah, I think I would say as we look to the future, building a hospital is one of the most complex structures human beings design right now,
Yes.
short of a nuclear power plant.
Sure.
With the amount of regulation that needs to go into it, the systems, the interconnections, and everything else. So we not only forecast what we would need today on the day we open in December, but what we're going to need 10 years, 15 or more years down. We put in extra infrastructure, extra cabling, extra network capabilities so that as technology continues to evolve, as the university develops other treatment plans and other capabilities that we want to be able to bring into the facility, we've already created a structure and a facility that's adaptable and can more easily bring it in. Some of our next evolutions will be virtual nursing that'll go into the inpatient care rooms to support the nursing staff and remote physicians. And so we're preparing for the future in the present.
That's unbelievable. Virtual nursing. Is that what
Yes.
you just said?
Yeah.
Yes, absolutely. I was just going to say that I think when we think about all the things we've been doing to prepare for this hospital opening, it is not just about December 10th. It is really about the next 5 years, 10 years,
I
and
love
20
that.
years, because we are a foundation and we are really the, let's say, innovators, if you may, of what healthcare delivery will look like for the future.
Yeah.
Because, long gone are the days of even the noise of pagers and technology where you're handing people pieces of paper, whereas you want to be able to give patients the ability to have ease of and convenience of access to their information, and also the ability for us to be able to, from a clinical standpoint, observe them even remotely. And what does that look like from a system level? And we're building all that now.
Yeah.
Like when I said we are making history, I really mean that from both a quality and a clinical care perspective, but also for the community that we're going to be serving here and beyond.
Yeah, that's great. Joe, what about you? Just in terms of your viewpoint on the future of what this place, means.
It's really exciting to live the idea of healthcare without harm, and the folks that we get to serve, the community that we're healing. The building itself is actually going to be part of that, and the idea that we're going to be operating with no impact to our local residents, and we're actually going to be improving the quality of life. Hospitals historically have always had, they're one of the most energy intense buildings
Yeah.
out there.
Yep.
This is a little bit different, and we're going to be making history and trying to help our partners to showcase what we can do better in the future. So
Yeah.
really excited about that, and to help others as they come along, try to do things a little bit differently.
Yeah. All right, let's talk about how this facility will impact the rest of the UCI Health system.
Okay. So in 2021, when we started designing this campus, there was only one campus, and it was the Orange campus. And this was going to be our first attempt at mitosis, coming back to the campus like we talked about. But while we were in that construction process and in that build process, we've now even grown with 4 more campuses throughout Orange County. And so how this supports both Orange, Fountain Valley, Placentia Linda, Los Alamitos, and Lakewood is what we establish here, the processes, the technology that we begin to roll out and initiate here as version 1.0. We take version 2.0 and spread it through the system so everybody benefits.
Yeah.
Yeah, I would say as an example, I was talking to a pharmacy leadership team, and I think as a health system, there's always opportunity to improve certain practices. And part of our discussions and we get the opportunity to do here is to create workflows here because of the physical space and the different sort of band of teams that are living in this actual building. Whatever we do foundationally is an improvement to the process.
Yes.
Which is a wonderful opportunity to share within the whole health system. And I have already been asked by multiple leaders, oh, Joe, that's a really great process. Let's share that at this particular other facility. And I think that's the piece where we have these aha moments of just improvement for patient care, for workflow, for clinical decision making, which I think is a very important piece when you look at the whole health system as a whole, because everybody benefits.
Yeah. just from like even a simplified way to look at that, you could think that the other places might go, oh, they're almost jealous of this new place, but then it benefits them.
Absolutely. And,
Yes.
and UCI for some areas stands for under construction indefinitely. So with the new,
I love that.
the new shiny hospital, a lot of our newly acquired places are looking at it saying, you know, you might have just built this, but what are we going to do over here? And we're
Yeah.
going to take, just like what Jess said, what we learned at this new campus, we're going to bring that over to these new sites. Orange, Los Alamitos,
Yeah.
Placentia Linda, all of those sites, we're going to take what we learned here in Irvine and apply that to those sites here in the near future.
Yeah, that's awesome. It's very exciting to be here before before it gets off the ground. And really, hats off to the three of you and your teams for every amazing thing you guys have created with this. So, congratulations! And it's truly unique and really special to sit down with you three. Thank you so much.
Thank you.
Thank you.